Hello, hello, hello. Good morning, good afternoon, good evening, wherever you may be, my family and friends of caregivers. This is Jonas, your OG nurse from the Nurse's Bunker and Mind Over Matter. And today we will be talking about the 5 common types of caregiving relationships. I am not a certified caregiver. I am, however, a nurse. So I guess that qualifies me as one. Caregiving relationships encompass a wide range of roles and responsibilities. These relationships can exist within families, between friends, or in professional settings. Each type of caregiving relationship has its unique dynamics and considerations. Let's explore some common types of caregiving relationships. The first one and the most common one is the family caregivers. Family members often take on caregiving roles, providing assistance and support to their loved ones. Family caregivers can be spouses, children, siblings, or extended family members. They may provide personal care, help with household tasks, manage medications, or accompany their loved ones to medical appointments. These relationships can be complex emotionally as they involve existing family dynamics and relationships. Second one is the formal caregivers. These are trained professionals who provide care services in various settings like hospitals, nursing homes, or assisted living facilities. Formal caregivers include nurses, certified nursing assistants, home health aides, and personal support workers. They provide personalized care, help with activities of daily living, and administer medication and monitor health conditions. Professional caregivers often have specialized training and experience in specific areas of caregiving. Third is the informal caregivers. Informal caregivers are non-professionals who provide unpaid care to individuals in need. Caregivers can be friends, neighbors, or family members, or members of community organizations. Informal caregiving relationships can arise when there are gaps in professional care, or when individuals prefer to receive support from someone they know. Informal caregivers may assist with errands, companionship, transportation, or emotional support. The fourth is the long-distance caregivers. Long-distance caregivers are individuals who provide care and support from a distance. They often face unique challenges in coordinating care, managing finances, and staying connected with their loved ones. Long-distance caregiving may involve regular phone calls or video calls, coordinating local resources, or providing support during visits. The fifth and last one is a specialized type of caregiver relationship, and these are called the Dementia Caregivers. Dementia caregivers face specific challenges due to the progressive nature of the disease. Alzheimer's disease, for example, requires caregivers to understand and adapt to the changing cognitive abilities of their loved one. These caregivers may need to assist with personal care, manage behavior changes, and ensure a safe environment. Support groups, educational programs, and respite care can be valuable resources for dementia caregivers. It's important to remember that each caregiving relationship is unique, and the dynamics can vary widely on individual circumstances. These relationships, influenced by factors such as the care recipient's needs, the caregiver's abilities and resources, cultural norms, and the availability of professional support systems. One approach that can help navigate caregiving relationships is person-centered care, which focuses on tailoring care to the specific needs and preferences of the care recipient. To explore different types of caregiving relationships and gain practical insights, I recommend the following resources. One is the Family Caregiver Alliance, and they can be found at www.caregiver.org, and they offer extensive information on caregiving roles and relationship dynamics within families. They provide resources, fact sheets, and educational materials for family caregivers. Second is the National Institute on Aging, and they can be found at www.nia.nih.gov, and they provide comprehensive information on caregiving, including different types of caregivers, tips for providing care, and self-care for caregivers. Third one is the AARP. www.aarp.org, and they offer articles, guides, and resources that cover various aspects of caregiving, including the different types of caregiving, relationships, caregiver support, and legal and financial considerations. So, in summary, exploring different types of caregiving relationships involves understanding the roles, responsibilities, and dynamics associated with each type. Family caregivers, formal caregivers, informal caregivers, long-distance caregivers, and dementia caregivers all have unique considerations. Utilizing available resources such as those provided by the Family Caregiver Alliance, the National Institute on Aging, and AARP can help caregivers gain valuable insights and support for their specific caregiving relationships. Remember that self-care is essential for caregivers to maintain their own well-being. Seeking out support networks, taking breaks, and accessing available respite care services can all help caregivers manage the demands of their roles more effectively. Again, this is Jonas, your OG nurse from the Nurses Bunker and Mind Over Matter, and we're on a mission to support our family caregivers. We are committed to try and help others who care for others in our own way. We believe that family caregivers deserve our support, and we are here to help them in any way that we can. So, if you are a family caregiver, please reach out to someone today. Connect, share your thoughts. If you got a topic you're itching to explore, drop it in the comments below. Remember, you're not alone in this journey. Whatever you are going through right now, chances are somebody's been there. Chances are they will be able to give insights that might help you in your case. So, smash that like button, hit subscribe and the notification bell, and spread the word to those who could use a helping hand and help others who you think might benefit from these Finder videos. Thanks for tuning in, and we'll see you in our next video. Keep caring, keep going, and kindness and blessings will surely follow you. Mabuhay!